Good afternoon, and welcome to a first look at the North Carolina Online Brain Injury Screening and Support System, OBISSS platform webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Susan King Lanier and Jessica Holyfield. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions, an overview of brain injury, a review of the online brain injury and support system, and a question and answer session. At this time, I would like to turn it over to Scott Pokorny, Traumatic Brain Injury Team Lead, IDD, TBI, and OMSAS section for the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you, and good afternoon, everybody. Welcome to this exciting presentation and training, and we really appreciate you all coming and joining the event today. We are super excited to launch this platform. Before we go forward, I wanted to thank specifically Disability Rights North Carolina for bringing the OBIS system to North Carolina last year. They were the original entity to stand this up in our state, and we are happy and excited to partner with them and expand this out more fully statewide for everybody to be able to engage. So this platform, excuse me, is also a part of our TBI State Action Plan strategies. So I would encourage you all to take a look at that state plan, which was just kicked off July 1st and is really going to be the guiding roadmap for all of our brain injury work for the next 3 years. And this certainly being an integral part of that work. So without further ado, I would like to introduce Amanda Neser. She is with the National Association of State Head Injury Administrators, and we are excited to bring this to you all today.
Thanks, Scott. Welcome, everybody. While I'm not speaking today, my colleague Haley will be leading the conversation. We just thought it would be good for me to pop in and introduce myself quickly. I'm with the National Association of State Head Injury Administrators, or NASHA. I'm a program manager there, and also the OBIS administrator. Haley will tell you a little bit more about NASHA when we get started. We are an organization that supports those who support those with brain injury, and we developed the OBIS tool that you'll be learning a little bit more about today. My role on that team is to, kind of the building of the system and the coding, technical maintenance, and kind of the customer service technical support issues that arise along the way. So I'll be in the Q&A panel if needed, and you may be connected with me at some point in the future if any kind of assistance needs arise. But for now, I will turn it over to my colleague Haley to get us going.
Thank you, Amanda. Hi, everyone. I am Haley Cushion. I am NASHA's Director of Program Management, and one of the programs that I get the pleasure of managing is the OBIS system, or the Online Brain Injury Screening and Support System. So thank you for joining us today. I'd like to thank Disability Rights North Carolina as well for being the North Carolina pioneers and their leadership in bringing the OBIS to North Carolina initially, and then Ginger, Scott, and the team there at in the state for continuing the OBIS for North Carolinians. So thank you very much. We really love your partnership and appreciate your leadership in this space. So we'll go on with the content today. We are going to be talking about screening for brain injury, and I want to tell you a little bit about what NASHA does. Next slide, please. So before we get into the brain injury overview, NASHA is, like Amanda said, we support the states and the partner organizations who support those with brain injury within respective states. We also look at leading policy and resources nationally. We look at best practices and trends that are happening among the brain injury community and send those out to the states so they can get them out to those that they serve. So we're very fortunate to work with North Carolina as a partner in that respect. So I know many of you probably have a sense of brain injury already, and that's kind of what led you to this session today. But I wanted to give a little bit of an overview about how we're going to be talking about brain injury in the context of screening today. Next slide. When we talk about brain injury, we're talking about post-birth brain injuries and those that are associated as acquired brain injuries. We're talking about traumatic brain injuries, which are external force. Think of car accidents, gunshots, violence, falls, sports concussions, blast injuries in combat. And we're also talking about non-traumatic brain injuries, which I want to say still happen in traumatic ways, but they are external events like stroke, tumors, infections, lack of oxygen, and this includes a drug overdose with reversal and also strangulation with the loss of oxygen to the brain. Next slide. We're going to talk a little bit about concussion in the respect that a lot of people brush off concussions as just something that happens and we can go on about their day. And I would like to say that when people think of concussions, before being educated about concussions, they think, oh, well, I didn't have a concussion because I still remember everything that happened, or I didn't lose consciousness. And we know that 90% of concussions are not associated with loss of consciousness, and that symptoms can develop over days and even months later. We also know that 90% of the quote unquote milder brain injuries do go unreported for many reasons. It could be because the individual was not allowed to report it or to seek medical advice. It could be because someone is underinsured. It could be because they fear repercussion if they went to a doctor or a hospital, or it could be that they don't think it was a big deal and they go on about their day. There's two significant reasons why these milder brain injuries can result in lasting impairment. And that is if there's repeated exposure of the brain injury, say like in repetitive abuse situations or combat in sports, or if there's another underlying co-occurring addiction such as substance use disorders or mental health conditions. Next slide. When we're looking at this chart, I want us to read it as this. This is a chart of a couple different vulnerable populations. The general population, when they've experienced a brain injury with a loss of consciousness, that's at 22% of brain injuries have a loss of consciousness. 5% of brain injuries are those that we consider moderate to severe. But in a substance use disorder treatment setting, 53% of the brain injuries come with a loss of consciousness, and 17% of those are labeled as moderate or severe. So you can see as we get into some of these vulnerable populations or special populations, as it's sometimes called, you can see that the incident level of severity also rises. Next slide. One subpopulation that we talk about that has a large intersection of brain injury is those in the military or veterans. We're seeing that a lot of brain injuries, especially post 9/11, come from non-combat related injuries. And it could be that they come from training related injuries. Also, we find that those in the military are more risk takers. And you think about if you think about men ages 18 to 30, they have more of a risk-taking tendency, or they are often more involved in activities outside recreationally or avocationally that have a higher incidence of brain injury. They also have a higher consumption of alcohol in military personnel that can lead to those higher incidence of brain injury. Next slide. Another subpopulation is those experiencing homelessness. One study found that 43% of respondents reported a history of brain injury with an average age of the first injury being 15. So it could be that the brain injury led to a more likelihood of experiencing homelessness, or if someone's experiencing homelessness, that they're more likely to experience a brain injury. Individuals with a brain injury become homeless at a younger age and are more likely to report mental health diagnoses, substance use, suicidality, victimization, and difficulties with activities of daily living. So if you are working in that setting, or maybe you screen for the likelihood of someone to become homeless, that it may be that you want to also screen for brain injury as well. Next slide. Another subpopulation is those experiencing intimate partner violence or domestic violence. We've seen a study that says as many as 23 million women in the United States have experienced intimate partner violence, also live with a brain injury. And we also know that domestic violence, intimate partner violence isn't just a subpopulation for women. There's also men in this population as well. But we also know that those experiencing domestic violence or an intimate partner violence are most unlikely to follow up with emergency department visits or a physician to seek medical care along with their injuries. Next slide. Another subpopulation to consider with screening is those in the criminal legal system or criminal justice. It's found that up to 60% of those in the criminal legal system report a history with brain injury, as opposed to 8.5% in the general population. So that is a huge jump in incidence when those experiencing involvement within the criminal legal system. So that is also something else to be aware of when you're thinking about who to screen and who not to screen. Next slide. So we're going to talk a little bit more about the online brain injury screening and support system, or the OBISS, OBISSS. It is 3 S's. Next slide. It is an online system, and it's used to determine the likelihood of a brain injury to have occurred, and to identify associated challenges that may be present for youth and adults. The OBIS is available for those aged 10 and up, with the caveat that if you are screening a youth or someone even as young as 10, it's appropriate to have somebody who knows the history of the child who is being screened. And that doesn't necessarily have to be a parent, it could be a guardian or a custodial entity. The benefits is to the client is that there is identification of a traumatic brain injury or non-traumatic brain injury history. And it is the potential of a history. It's not a diagnostic tool. We're looking at the potential of a history associated with brain injury. And then also the client gets to identify current challenges that they may be experiencing based on the brain injury, and get supportive strategies that can help them regarding those associated challenges. The professionals also get associated strategies for those challenges that are identified by the client. So the professional also gets a takeaway of having some information that can help them with serving the client moving forward. Next slide. The OBIS does use two tools that have been around for a while. The one tool is the Ohio State University Traumatic Brain Injury Identification Method, or the OSU TBI ID. It has been around for about 17 years and is widely used within the brain injury community, typically as a pencil and paper identification method. And what we've done is we've used the online and self-administered version. So the tool can be self-administered or administered with the help of a provider. And we take away the time that it takes to score on paper, and also take out any potential error with human scoring. We also use the symptoms questionnaire for brain injury that was developed in Colorado, but we call it the SQUIBI. There's a youth and adult version of the SQUIBI, and this is what looks at potential challenges that exist because of a potential history of brain injury. Next slide. So the OSU TBI ID, it doesn't pick up on every bump and bruise to the brain. It picks up on those bumps and bruises to the brain that are likely to still be causing a challenge. And it's those challenges that may be causing barriers to one having a successful time in service delivery. So let's say someone has an undiagnosed brain injury or brain injury they don't really know is causing challenges. They are forgetting to come to appointments because they just are not finding a great way to remember those appointments, and they miss their probation appointments that they're supposed to be going to regularly. Well, the OBIS is gonna potentially pick up on the potential brain injury and find that someone is having a challenge with memory. And then the OBIS produces those tips and strategies that helps a person to use some modifications to remember that appointment. So they'll be able to better comply with probation guidelines, for instance. So we're looking for those injuries that are those potential injuries that are causing barriers to one's life in some capacity. Next slide. The SQUIBI that I talked about does look at 9 different areas of challenge, from memory, processing, attention, inhibition, physical and sensory motor challenges, language, organization, mental inflexibility, and emotional dysregulation. So these are the 9 different areas that someone with a potential brain injury may be having challenges with. And again, it's not all of them, but these are the 9 different Next slide. The OBIS does gather some really useful demographic data to make comparisons above settings and demographics to help inform programs. So, and what I mean there is if we're seeing a lot of positive potential screenings in a criminal legal system setting, then it would tell us there needs to be more training for the support staff or officers in that facility to work with individuals in a brain injury informed way. And then we could also see that those that are screening positive for potential brain injury in the criminal legal system are screening a lot for having challenges with attention and language. So let's make sure that attention and language strategies are used within those settings more often. So it can really give us a lot of good data to help manage resources and programming. Next slide. So this slide just tells us that those tip sheets that include the strategies to assist with those challenges associated with brain injury do go to the participant, and then they also go to the provider. And so everybody leaves with strategies to help the individual along the way in whatever capacity is needed. Next slide. So what is needed to get started? It is an internet-based tool, so you will need a computer or mobile device with internet. There's a link or a QR code that we also have on some of the promotional materials to the OBIS. And North Carolina has a login that you would need to get started. The OBIS also requires a provider email address. So we say that the OBIS can be self-administered, but we also like to say it can be self-administered but provider driven. So we would like someone to be working with the provider so they can include that email address so the provider can also help with strategies along the way. But that's not an absolute requirement. If someone is not working with a provider yet, then there's many services in North Carolina that can help guide someone along the way to take the OBIS as well. If the internet is not accessible or a device is not accessible, there's also a paper copy available to use as well. But after you put information in on the paper copy, it does need to put it online to produce those results and to produce those strategies. Next slide. So these are the different levels of administration for the OBIS. Like we said, the OBIS can be self-administered. So it is a participant, the first level administration is participant-led, where the individual takes the OBIS independently. This could be that they find the information on North Carolina's website and decide to take the OBIS on their own. Or it could be that a provider recommends the OBIS to an individual. They take the OBIS and then they discuss the results of the OBIS maybe at a follow-up meeting or appointment. The next level of administration is provider assisted. And this is when a provider is present when the participant takes the OBIS and is present for support and questions along the way. This can also be done as a group administration. Maybe if there's a group of people that want to take the OBIS and there's one provider that is kind of available for support along the way to answer questions in a group setting. The third and final level of administration is provider-led, and this is where the provider administers the screener to the participant and walks the participant question by question through the screener. We look to the provider to help choose the most appropriate level of administration based on the participant's ability and knowing the participant. We also like to say that the screener is not meant to be done within a time of crisis. So not necessarily the best place for the screener would be, let's say, the emergency department, or if someone is in detox or is trying to find safety from abuse. But maybe the screener could be done. We like the screener to be done within the first 2 to 3 meetings of someone or encounters. This way, if someone is missing appointments due to challenges related to a potential brain injury, they're not dismissed as non-compliant or not wanting to continue service because they're no showing based on their challenges related to brain injury. So it's, but we also know that many times the first appointment or what we call the intake appointment that someone typically has within service already has many screeners or paperwork that's got to be done. So the first 2 to 3 meetings is a good medium there for the screener to take place. Next slide. So here are the steps to the OBIS. We're going to walk through the participant process, and then we're going to do a demo of the OBIS. Next slide. So first, the participant is going to go through a consent form and some basic information, and then they'll have a couple questions that are specific to North Carolina to answer. And then they'll go on to the OSU TBI ID, which is going to ask for things like, have you ever been seen in the hospital room for an injury to your head or neck? Think about injuries that happened in your lifetime. It's also going to ask about different mechanisms of injury. If a person does not have a potential brain injury based on the questions, the answers to the questions on the OSU TBI ID, the OBIS is then complete. If there's a positive for a potential brain injury, they'll go on to that symptoms questionnaire we talked about and look at the different challenges related to potential brain injury. If there's no challenges, the OBIS is then complete. If they're positive for some challenges, then they'll get tips and strategies sent to them through secure messaging that is helpful in their service delivery. And next, we're going to have a video. If we'll go to the next slide here and go ahead and begin it, and then I'll see you on the other side. Once you access the OBIS through a link or QR code, you'll see the welcome page. Please enter the state or subscriber name that you were given and the subscriber code. The OBIS can be self-administered by the participant or administered with the help of a provider. The questions are written as if the participant is answering all the questions, such as, which state do you live in? You'll enter the subscriber code once again and the email address of the professional working with the participant. This is so the professional can get the results of the OBIS. Next, enter the age of the participant. The next screen is a consent form for either adults or youth. Please read this carefully and answer the questions provided. Please note the privacy policy is available through a link. Most versions of the OBIS will then ask for first name and last name of the participant and the email address of the participant. This is if the participant would like to receive results of the OBIS. It is recommended that an email address is provided if they are safe to use email and also have access to email. Next, you will see a completed version of the consent form. This is where you can save, download, or print the consent form at this time. However, it's not necessary as the consent form will also be emailed to the provided email addresses. Next, we will ask questions about the participant, such as gender, race, ethnicity, relationship status, highest grade completed, military experience, and the description of the program that asks you to take the OBIS. Some versions of the OBIS are called demographic light versions and will not show this page. Next, we are going to ask questions about any history of injuries to the brain in one's lifetime. The first several questions are yes or no to questions such as, In your lifetime, have you ever been hospitalized or treated in an emergency room following an injury to your head or neck? Please read the questions carefully and answer the best you can. The next several questions are asking yes or no to have you ever been told by a doctor or other healthcare professional that you've had any of the following: epilepsy, stroke, tumor of the brain, swelling of the brain, brain bleed, brain cancer, brain infection, loss of oxygen to the brain, toxic exposure, dementia, and progressive disease. This is a results screen. It's showing us that the results show that you have had a possible brain injury sometime in your life that may still be causing challenges. Please remember this is only a screening tool and not to be a diagnostic tool. It is very important that you hit submit on this page, even if you don't have a possible brain injury. Once you hit submit, this tells the system to send the email addresses information about the OBIS. Now we're going to go on to the second part of the OBIS that talks about possible challenges that one may be having as a result of a potential brain injury. This is called the Symptoms Questionnaire for Brain Injury. There's an adult and youth version. There are 9 sections where we want the participant to answer each of the items on a scale of I do not have this problem at all to I'm extremely bothered by this problem. How much in the recent weeks have you been bothered by the following problems? A participant may not have any experience with problems from one of the items, and that's fine. All they have to do is click, I do not have this problem at all. Each section talks about a challenge that's very common to those experiencing brain injury. These items are very important as it provides crucial information to the participant and the provider that can help the participant in service delivery. After section 9, please go to next page. The system will tabulate the score and tell us if the participant is possibly having challenges related to a brain injury and which challenges they may be experiencing according to the symptoms questionnaire. Tip sheets and strategies can be accessed directly from the screen through the hyperlink. And also, once you press submit, the information tabulated by the OBIS and tips and strategies for each of these challenges will be sent to the email addresses provided. It's very important, even if the screen is showing no challenges experienced, that you press submit to end the screener. Once you see the screen, you will know you are done with the OBIS, and you can go to the email address that was provided to see any follow-up information. Thank you. Okay, if we can go to the next slide, please. All right, so why use the OBIS? We know that the OBIS is adding an extra layer of what you would work on with a client or a participant, but we also know that it takes time to save time. So knowing that you're providing the proper supports to someone and mitigating any of the challenges that they may be experiencing due to a potential brain injury is going to help the work on the other end to help someone have more successful service delivery. It's also going to eliminate frustrations for the provider as well. And we've seen it also help with burnout for a provider to eliminate, the amount of no-show reports that have to be written, or reduce the amount of times that a provider has to spend repeating instruction because they're now using compensatory strategies to help with those challenges. And we're also going to improve communication and improve the outcomes of service as well, because we're addressing those challenges that may be present. Next slide. So this is a very small print, but it also is a look at what the professional guidebook looks like. So on the left is the cover page of the guidebook, and on the right is the 9 different areas of challenge that the guide is broken up into. And then we also have a bonus section for sleep hygiene, because that's very important as well. Next slide. This is even smaller print, and again, not meant to read, but it is meant to show that the provider's guidebook on the left will look different from the participant's guidebook on the right. The provider's guidebook is written to the provider in language for them and with strategies for them, whereas the participant has their own set of strategies that are geared towards them. Next slide. So just a couple things that NASHA does have available for screening partners of North Carolina and providers that are using the OBIS for participants is we have a monthly office hours for OBIS assistance. This is meant for any subscribers, screening partners, or any interested screening partners are welcome to attend. You must pre-register. It's every third Wednesday of the month from 2:30 to 3:30 Eastern. You don't have to stay for the whole time. It is a come and go, come and ask your questions and leave, or you can come and listen to the questions that others have. Another support we have is a screening partner or provider app. This has a quick access link to the OBIS. There's quick access to resources available and information about where to get additional supports along the way. And that QR code listed is where you can find the information for the Screening Partner app. And it's also in the chat as well with a link. Next slide. So the importance of screening, we want to know if someone has a current impairment that is getting in the way of service delivery or the way they operate in their daily life and with ease. And we also want to make sure that there's appropriate and effective adjustments and accommodations that can be implemented to help the person along the way. It's best practices, it's ethical, and it's just the right thing to do to make sure that we're being effective in service delivery. And also identifying the current challenge or impairment will help increase the person's ability to advocate for themselves. We've seen people take the tips and strategies and share them with other people in their family or a physician or social worker or someone else that they're working with in service delivery or in life, and to say, hey, it's not me forgetting things because I don't care. It's maybe a potential challenge related to a potential brain injury, and I'm working within this challenge along the way. I'm working with this strategy along the way to help me with that. Can you help me with that as well? So it can be a very effective tool all around. Next slide. There's also a tiered approach to screening. So I get this question a lot and wanted to include it here. So the first way, the first tier to screening is self-report. We don't always have medical records. If somebody gets a CT scan after an injury, it's looking for further injury where it could be a bleed or swelling. We're not looking for those milder injuries because those are on cellular levels and can't be picked up by CT scans. So someone may say, oh, so I may have a potential brain injury because the OBIS said so. Do I need to get a CT scan now? No, that's not necessarily the case unless they are having some more symptoms and they feel more comfortable following up with a medical professional. Then that's certainly something that they can do. We also like to say that if the once someone goes to the OBIS and they're using these strategies to help them with challenges along the way, and it's just not fitting the bill, and maybe there are other challenges beyond what the strategies can help with, then we recommend a neuropsychological screening, which can be done typically with master's levels clinicians. NASHA has a course for neuropsychological screenings as well to help in a brain injury informed way. But also, they take less time. They're usually about an hour to an hour and a half, sometimes less than that, and they're not as expensive as a full neuropsychological evaluation. A full neuropsychological evaluation, and I personally love all the neuropsychological psychologists that I've ever met. They're great and do great work, but they all typically have a waiting list, and a neuropsychological evaluation can take 1 to 2 days. And can be quite expensive and not accessible for everyone. So sometimes self-report is the best way. And if more support is needed, a neuropsychological screen. And if more support is needed after that, a neuropsychological evaluation. Next slide. This is some data that we've gotten from OBIS along the way. So this is a look at one of the year's data and how we read this. I know it's a very small print as well, but we're looking at, let's say, those in the housing support services. Out of 60 screens that were done within the housing support services setting, 83.3% of those were positive for a potential brain injury. So you can see how the chart reads across the way there. For instance, 25 screens were done in a vocational or employment services setting, and 96% of those were positive for a potential brain injury. Next slide. This slide shows us the symptoms and challenges from all subscribers that were screened positive for potential brain injury and the different symptoms and challenges that they screened for. For instance, out of all those that screened positive for potential brain injury, 939 of them, or 71.9% of them, screened to have a challenge with inattention. On the flip side, their impulsivity was screened for or caught as a challenge for 49.5% of all subscribers who identified to have a potential brain injury. Next slide. So here is the QR code or the link to get the OBIS. You'll go here to take the OBIS. When you log in, you'll need to put in the name North Carolina, and then you'll need to use the subscriber code or password of 704. If you have any questions along the way, your North Carolina OBIS administrator is Scott Picorni, and his email address is scott.picorni@dhhs.nc.gov. And then something also very important is, and I believe we have a test flyer that, or how to do a test record, that we can put in the chat as well. And also, if you are doing a test record, the subscriber code for the second time you put in the code, you'll need to put in 7040. This is how you can do a test record, and your test data does not go into the data set that we look at to help improve programming. So if you're doing a test record, the first time you log in, you'll use 704, the 3-digit code. But the second time you enter the subscriber code in the OBIS for a test record, it'll be 7040. Next slide. All right, we are where we can get some questions and any discussion along the way. I believe the Q&A is where you would need to put in your questions. And I'm happy to answer anything along the way. And I don't know if the slide deck can come down or it needs to stay up during question time. I'm certainly comfortable with either way. Someone did ask in the Q&A, how can we share this training with colleagues? The recording and the slide presentation will be posted on the webpage for later viewing and dissemination. And then Michelle in the Q&A asked, can you share a sample tip sheet? The sample tip sheet for impulsivity is in the slide deck. And in the subscribers app, there is a link to tip sheets as well. Will the code 704 remain the same at all times? Yes, it'll be the same login every time you do a OBIS screening with a participant. The only way that it changes for someone is if they're doing a test record, and that is them putting 7040 the second time you have to enter that. And I believe we can get the how to do a test record flyer for North Carolina to Scott and his team to put that on the website as well, along with the webinar. Janice asked, once the screening is completed, are referrals made to medical doctors? What are the next steps? So a referral can certainly be made to a physician. That is not my wheelhouse to say that someone needs to go to a medical professional, because certainly medical professionals can help with adjusting medications or help with managing some of the symptoms related to a brain injury. So that may be the best next step. Also, it's not, but it's not a required next step. It's basically to the judgment of the provider if a medical referral needs to take place. But what we suggest is, try the tips and strategies and see if the challenges that a person is experiencing improve along the way. If there's certainly symptoms that seem like they're getting worse or need to be addressed by a medical professional, then we would absolutely, recommend a medical evaluation. There's a question from Matt. I noticed the plan includes developing a TBI peer support certification. I lead a nonprofit providing peer support for stroke survivors. Who can I connect with to learn more and explore potential collaboration? That's great, Matt. That's great work. I believe Ginger would be able to answer that question.
Yeah, I'll come off mute. Hey, this is Ginger. I'm the Chief Clinical Officer for IDD TBI and Olmsted at DMHGDSUS. If you could email Scott Picorni directly if you have his email. If not, I will drop it in the chat.
All right, another question here. Does the OBIS know if someone has already done the screening? For instance, that they have done it on their own and then come to their provider or MCO and they are trying to do another screen, will there be a notification? Good question. No, we do not limit we do not have the mechanism turned on to identify if someone's already taken the OBIS or not. This is because we want to allow individuals to take it a second time, maybe if they've had another encounter of potential injury, or maybe their symptoms or challenges may have changed some. So we don't limit people to having one, and it's also they may be able to keep their record of their scores and results, and then certainly share it with their provider. But they can certainly take it again as well. These are great questions. Usually I don't get questions, so this is great. Scott, did I address everything that you would like me to along the way, or is there anything else that I can clear up for anyone?
Yeah, I think you did a fantastic job sharing the platform with everybody. I did want to just, if you could talk just briefly about how a person might be able to do the screening, and then if they don't have time or aren't feeling up for it, they could come back and do the symptoms questionnaire later if they chose, and how that would work.
Yes, absolutely. Great question there. As you may have seen in the demo, there is a save and return later feature on every page of the OBIS, to where someone could come back to take the OBIS at a different time. Maybe they grew tired, they're fatigued, there was an interruption in the time that they needed to take the OBIS, or they just want to come back later and take it at another time. You can choose to save and return later, and there will be a prompt that has you enter an email address and record a code. So when you're ready to continue with the OBIS, you'll go to that email address, click the link, enter the code, and all of your previous results have been saved, and you can pick up where you left off. Great. And Amanda, thank you for putting the flyer on how to create a test record for North Carolina's OBIS. It is in the chat. It is a great resource, and it explains how to use that 4-digit 7040 code. Thank you.
Okay, are there any other last questions before we wrap up? And I know this is a lot of information to take in, so if you do have questions, feel free to email me, or you can also email our TBI general email box. We do monitor that as well. And I can put that in the chat for you.
While you're doing that, Scott, I just want to reiterate what an incredible resource this is for North Carolina, to have a resource available to identify those potential brain injuries that are getting often missed, or individuals experiencing challenges that they don't know why. So please do use this as a helpful resource, and reach out if you have any questions along the way. Do a couple test records and see how you like it. Maybe do some live screenings with a couple of participants and see how it goes. But really get in there, and don't be intimidated by it. It's a easy system, and it guides you along the way with prompts and directions. So feel free to explore and get right in there.
Okay. Well, if there are no other questions at this time, then I would like to really thank Haley and Amanda for the presentation and all of the great information you all shared today. I wanted to just make a couple of key points for the group. before we close out, and just to let you know that this is our very first statewide initiative that includes all acquired brain injury as part of the screening options, as opposed to a sole focus on traumatic brain injury exclusively. So that is a super exciting development. We'll really be able to learn more about the incidence of acquired brain injuries across the state moving forward. I also wanted to note that the symptoms questionnaire is definitely a very positive, welcomed component to the screening process. We have been screening for several years, and one of the through our tailored plans and other partners, and one of the concerns that had been consistently raised is, so once we identify somebody as possibly having a TBI, what can we do to support them or to offer them any type of mechanism to help address the challenges that they might be experiencing? And in the past, there was very little, and now with the symptoms questionnaire, that is able to offer those tip sheets that can really provide that more immediate support to at least start addressing some of the symptoms that a person might be experiencing. We really ask that you please spread the word about this platform through your networks. The link and the QR code to the OBIS platform, along with the subscriber, which is North Carolina, and the password again, which is 704, will be posted on our TBI webpage soon. We do plan to officially kick off the OBIS on August the 1st, so that's just in a few days. And just to let you know, there will also be a second presentation on this in August. So if you have partners or others that you know that would be interested in attending another live session, that will be happening probably around mid-August or so. We will be able to provide the date and time publicly shortly. And I did want to just highlight, since we have a group here, we are also having several other brain injury initiatives that we will be sharing out in the coming months. So we will be excited to be able to offer other webinar opportunities to learn about the tremendous amount of different brain injury initiatives that we are engaging in, and that you can read further about in our TBI State Action Plan. And then I'm going to hand it back over to Latoya, I believe.
Thanks, Scott. If we did not get an opportunity to answer your question during the webinar, questions and feedback are welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's webinar will be posted to DMH DDSUS webinars webpage. The links are included in the chat box. There will be a brief survey following today's webinar, and we would appreciate your time completing it. This concludes our webinar for today. Thank you for attending.